So just waiting to make sure the webinar is on here. Are we there? All right, so it's just about 2 o'clock, so let's go ahead and get started. Let's make sure the webinar
The broadcast is now starting. All attendees are in listen-only mode.
Okay, the webinar has started now. So good afternoon, everyone. My name is Fields Mosley. I'm the Director of Communications for Maricopa County. Thank you for being with us today. If you're a member of the public on YouTube or Facebook, also for reporters who might be joining us via the GoToWebinar today so they can ask some questions at this time. So we're here to give you an update on the COVID-19 pandemic here in Maricopa County, some of our situations, what we're seeing with this pandemic. I have with me today Marcy Flanagan. She's our Executive Director of the Department of Public Health for Maricopa County. Also Rebecca Sonnenschein, Dr. Rebecca Sonnenschein. She's our Medical Director for Disease Control. Also with us today for the question and answer period, we have Joanna Molina. She will be translating the answers into Spanish for members of the media that are reporting in Spanish language. And Vicki Bond has joined us here with American Sign Language as well, the translation for us today. So we have a short presentation from Director Flanagan here in just a moment. Just to remind reporters who have questions after that presentation, you will have to unmute yourself on your side of the webinar. And if you have any trouble either virtually raising your hand so we know to call on you, or unmuting yourself, if it's just not working, please log out of the webinar and log back in. Sometimes you have to do that to reset things and make sure that works. We cannot unmute you from this side on your device. So with that, we'll do some questions and answer right after this, but I'll introduce Director Marcy Flanagan from our Department of Public Health.
Good afternoon. We have been at this for a long time now. Tomorrow marks 1 year from the opening of the county's mass vaccination site and pod for our healthcare workers and for the first doses of vaccine that we gave out. January marks 2 years from the first COVID-19 case in Maricopa County. Having been dealing with this for a long time, we often get asked, when can we treat this like the flu? The short answer is, unfortunately, not yet. And here's why. When you compare COVID-19 to the flu in Maricopa County, 7% of people reported with COVID are hospitalized, compared with just 1% of people with the flu. And you are 27 times more likely to die from COVID than from the flu. With over 800,000 COVID-19 cases, that's 55,000 people who need a hospital bed and staff to care for them. We are still at the point where a large part of our population is at risk for severe disease. This is putting serious stress on our hospital system, which impacts all kinds of care, not just for COVID. Not only does that mean long lines in the emergency room, but also delaying treatment for illnesses that will get worse if care is delayed. We're asking you as a community to work together to help protect our healthcare system. We need to work really hard through the holidays. We know how to reduce spread, which keeps people out of the hospitals. Everyone, regardless of vaccine status, should take the following steps to prevent the spread. Get vaccinated and boosted. Wear your mask. Physical distance whenever possible. Wash your hands frequently, and stay home when you're sick. If you have symptoms, even just the sniffles or a sore throat, get tested and stay home. Follow isolation guidance if you test positive. Even mild symptoms in one person can lead to serious disease in someone else, and you can help break that chain. At Public Health, we're doing all we can to help slow the spread. We're still doing case investigations and contact tracing to identify close contacts, notifying them, and reduce the size and frequency of outbreaks, especially in settings like schools and long-term care facilities. We're working with our healthcare systems to keep them from getting overwhelmed. This includes supporting them with staffing from our Medical Reserve Corps, since it's not just beds, but staff for those beds that are needed. We're still putting out lots of community vaccine and testing events throughout the county, and we're encouraged by how many people are turning out to these events to get vaccinated. We are doing this to make sure that vaccines and tests are as available as possible, and so that we can prevent and identify infections to reduce spread. We are asking you to do 3 things. First, do what you can to help stop the spread over the holidays. I know it's been tempting to relax at times, but if there were ever a time for us to follow those measures, now is that time. Second, get your flu shot. It's not too late, and you can even get your COVID-19 vaccine and flu shot at the same time. And third, volunteer with public health if you can. Our Medical Reserve Corps of over 6,000 active clinical and non-clinical volunteers have put in thousands of hours throughout the pandemic, and especially since we started the vaccine efforts a year ago tomorrow. These incredible, dedicated volunteers have given so much, and we need to support them now by bringing in others who can help them take a break. They're burning out too. We need others to step up so we can keep going. Please go to maricopa.gov/COVID-19 if you can volunteer. This is not where we hope we would be this holiday season. However, we have vaccine now, and we all know what we have to do to help stop the spread. Thank you.
Thank you very much, Director Flanagan. So at this time, we'll open it up to any questions we might have, and your questions can be directed to Director Flanagan, or if it's more of a medical question, we'll see if Dr. Sonnenschein can provide that answer. So Jennifer, do we have anybody on the line with a question right now?
Nicole Grigg is on the line. Nicole, please unmute your phone.
Thank you. This is for either Dr. Sonnenschein or Director Flanagan. We keep hearing from hospitals holding press conferences that they're running out of space, out of ECMO machines, ICU beds. Hospitals can't find anywhere to transfer patients. Concerned that in January, Banner may have to cut back on care. What is the county health able to do before it gets to this point?
All right, thank you, Nicole. So what is the county able to do to help with some of the situations with hospitals? We know that some of the hospital groups, they had a press conference earlier this week. We're aware of that. So I'll have Director Flanagan come up and address your questions. Thank you, Nicole.
Hi, Nicole. Thank you for that question. So we're doing a few different things. The first is that we are helping set up monoclonal antibody locations that are outside of the hospital systems. Working with them. We're providing staff for those. We've also requested FEMA support to help staff those sites, and those should be opening soon. Those should help relieve some pressure on individuals that would typically have to go into the ED to receive those infusions. We're also helping provide staff through our Medical Corps of Volunteers whenever possible. And we've worked with the state and the healthcare systems to try to help ease some of the pressure on the backlog of getting patients discharged and into long-term care facilities.
Thank you, Nicole, for that question. Oh, I'm sorry, and Joanna is going to come up and translate now.
Bueno, la pregunta fue que se ha escuchado recientemente que no hay espacio, que no hay camas en los hospitales, que pudieran estar también reduciendo el cuidado a los pacientes, que es el cuidado que brindan. Aquí hay algunas cosas que se pueden hacer en estos casos. Salud Pública del Condado Maricopa está trabajando muy de cerca con los hospitales. También está trabajando para poder ofrecer la terapia monoclonal fuera de hospitales. Esto con el apoyo de la Administración Federal llamada FEMA, para poderles ayudar con esas infusiones a pacientes. También con el personal médico, algunos voluntarios médicos que llegarán a los hospitales, y también estamos trabajando muy de cerca con los hospitales y también con el Estado para poder ayudar en este caso cuando hay exceso de pacientes.
Thank you, Johanna. Thank you, Nicole, for that question. Jennifer, do we have somebody else on the line?
Brittany Thomason is on the line, and her line is unmuted.
Go ahead, Britt.
Hi, thank you so much for doing this. My question is for Dr. Sunshine. With hospitals already full, how worried are you with Christmas next week, and would you want the state to file any additional COVID mitigation plans?
So with hospitals already full, I'm sorry, can you repeat your question about the state and what we would ask them to do?
Yes, it's how worried are you with Christmas next week and hospitals already full, and would you want the state to file any additional COVID mitigation plans?
So Dr. Sunshine will address that question. Thank you.
Thank you for that question. So anytime people go and gather together with their family and loved ones, and particularly when people travel and populations mix together, we do expect to see increased transmission of any infectious disease, including COVID. So we do anticipate that we will see a rise about 1 to 2 weeks following the winter holidays. And that's why it's so important for people to be really careful when they're traveling, wear those masks in public settings, in public transportation, and if you're going to get together with your family or people outside your household, it's a good idea to get tested before you go and then again when you leave. Regarding increased mitigation strategies, we are working closely with the hospital systems, meeting with them weekly and working with Arizona Department of Health Services to find out what we can do on a regular basis to streamline care and maximize the ability of the hospital to take care of the patients and take some stress off of the emergency departments, including things like bringing in teams to give monoclonal antibody. Thank you.
Y la pregunta es, ¿qué tan preocupados estamos en estos días que ya la semana que entra es la Navidad y el próximo Año Nuevo? Y también con los hospitales que están llenos, ¿qué de planes deben de tener de mitigación o deberían existir en estos momentos? Bueno, cualquier momento en que las personas van a pasar las fiestas o van a viajar, se sabe que puede haber un contagio o incremento de casos que se pudieran ver. Tarda alrededor de 1 a 2 semanas para empezar a ver esos números que suban, por lo que es muy importante utilizar la mascarilla si va a viajar, el lavado de las manos también, y también si se va a reunir en familia o con amigos, hacerse las pruebas pertinentes de COVID para saber que es negativo. También trabajamos muy de cerca con hospitales, semanalmente nos comunicamos, al igual que con el Departamento de Salud del Estado, para maximizar todo el equipo, todo lo que ellos puedan hacer para ayudar a los pacientes, incluyendo lo que viene siendo la terapia monoclonal que se da fuera de hospitales.
Thank you so much for the question. Jennifer, who else do we have on the line today?
Luke Forstner is next. Your mic is unmuted.
Thank you. So I have a question regarding rapid at-home tests. I know a lot of people are taking them. I know I've taken one recently. How are those counted in terms of, people testing positive, but if they never have to go to the hospital, those tests those positive cases aren't being counted by the state? And I know several cities, including Mesa and Tempe, are giving out free COVID-19 home rapid tests and are encouraging people to self-report their results to Maricopa County so they can be counted. Are you encouraging people to do that as well? And if so, how can people self-report?
Yeah, that's a great question, Luke. So, yeah, a lot of Binax tests are widely available. Some are available for free in various municipalities and even at our county libraries. So I know this has been a popular program, but how are those counted? Director Flanagan will come up and address that question.
Thank you, Luke, for that question. That is a great question. So when we know that these at-home test kits are extremely helpful and we want everyone to have access to them, but there is the concern that not all of the testing is reported to us. We encourage individuals to go to your primary care physician and have them report the test results, or you can contact public health and we can record the test results. But we know that doesn't happen all the time, and we know that those cases aren't always reported to us. It's been similar since the beginning of the outbreak. Not all cases are reported to public health. If someone doesn't go get tested, but they stay home and do all the right things, that's what's most important. Thank you.
Y la pregunta es acerca de las pruebas rápidas o pruebas caseras. ¿Cómo se cuentan esos números de esas pruebas caseras? Hay ciudades como Tempillo y otras que están animando al público a que las tomen esas pruebas. Algunas se dan gratis. ¿Y cómo se reportan esos resultados? Bueno, sabemos que estas pruebas en casa son realmente que ayudan a las familias. Sin embargo, también sabemos que no todo el mundo reporta los resultados. Por eso es muy importante que la persona ya se vaya al doctor o llame al Departamento de Salud Pública del Condado Maricopa para reportar esos resultados. También sabemos que no todos los casos que se reportan quizás que sean positivos, pero también hacen lo correcto, quedarse en casa y hacer todo lo necesario para evitar la propagación de COVID-19.
Thanks, Luke, for the question. Jennifer, who do we have next?
Brittany Thomason, your mic is unmuted.
Thank you. This is for Dr. Sonnenschein again. For people who already had COVID, do they have any type of protection against Omicron, and how hard is it hitting people who already had COVID with maybe like the Delta variant or a different variant?
So an Omicron question. We'll do our best. Dr. Sonnenschein will do her best to address that question and how those variants are spreading.
So the question is, do people who have already been infected have any type of protection against getting infected again from Omicron and from other variants? So what we know is that getting infected with COVID does generally give you some protection against getting reinfected. The problem is it's not as reliable as the immunity that the vaccine provides, particularly when you get infected with one strain. We don't know how good of a job your body's immune system does at protecting you against new strains. And we did see that reduced effectiveness if you were infected with a prior strain, if you were then exposed to Delta. With Omicron, we just don't have enough information to know how much protection having a prior infection offers you. We're still learning a lot about Omicron. We are starting to see that although there is some decreased protection from infection with the vaccine is still highly effective at preventing severe disease, hospitalization, and death. So that's why we strongly encourage people to go out and get fully vaccinated or boosted. Thank you.
Y la pregunta es que para quienes tuvieron COVID, también ahora ellos cuentan con protección para los nuevos tipos de variantes como Omicron. Bueno, generalmente recibe la gente algún tipo de protección si ha estado infectada anteriormente con COVID-19, pero no tienen la confianza que se le pueda dar a una vacuna que puede protegerlo y que evitar que caiga en un hospital de gravedad, incluyendo de otras variantes como la variante de Delta. En el caso de la variante Omicron, no se tiene lo suficiente información aún para dar detalles y saber si está protegiéndose contra Omicron también con la vacuna. Lo que también se da información es que cuando usted se vacuna, usted se está protegiendo de caer de gravedad en un hospital.
Thank you so much, Brittany, for that question. Do we have anybody next?
Colleen Sikora is next. Colleen, please unmute your phone.
Hi, thank you all for taking the time today. We appreciate it. You've talked about just how we are a year out from the vaccine starting to be distributed here, and now we're in a situation again where, statewide 5% of ICU beds are available, which, at least as far as I can tell, is the lowest amount of beds that we've had available so far. And this is for either for Marcy or for Dr. Sunshine. Did you all expect to be here again in this winter surge again? And I guess, I think you've both talked about how, we need to take measures in order to try and slow the spread, et cetera. Is that just kind of where we have to go from here in order to get out of this?
Well, I guess I can say we certainly hoped we weren't going to be in this situation again. Director Flanagan will come up and address that question. Thank you, Colleen.
Hi, Colleen. Thank you for that. Asking if we knew we would be here again. Certainly, if you would have asked me when this started 2 years ago, if 2 years from when it started, we would still be here, I would say no. Even a year ago, when the vaccine became available, did I think we would be where we're at again? I didn't, but unfortunately, we have to deal with the reality of where we are. That's why we are really pushing the message that vaccine is our best protection in this pandemic. All the mitigation strategies that we know work, which is good. Since the beginning of this pandemic, we've learned a lot. We know that masking, we know that vaccination is the best. We know that masking helps, that staying home when you're sick helps, getting tested if you've been exposed, following the mitigation strategies, washing your hands often, all of those things work. So that's why it's so important that that's what we do right now. We hope that as time goes on and more individuals are able to get vaccinated and a vaccine becomes available for our entire population, we will get to a point where we're not having this discussion next year. But again, as long as we're in this situation, we need everyone to please help us keep our healthcare systems intact. Thank you.
Y la pregunta es que hace un año que ya pasó desde que salieron las vacunas y hoy solamente salimos al 5% de camas de cuidado intensivo disponibles. ¿Acaso se esperaba estar aquí en ese tiempo? Y la verdad es que hace 2 años que empezó la pandemia, nos hubieran preguntado, hubiéramos dicho que no. Un año hace ya atrás que salieron las vacunas, tampoco hubiéramos pensado que estaríamos aquí el día de hoy. Por eso sabemos que lo que funciona, todo lo que son los sistemas de mitigación, como la vacunación, el lavado de manos, el utilizar la mascarilla, el también hacerse las pruebas o quedarse en casa cuando están enfermos, funcionan, son métodos que funcionan. Esperamos también que ahora que salga la vacuna, cuando esté disponible para toda la comunidad en general, esperamos que no llegar nuevamente a otro lugar como el día de hoy, un año después.
Thank you, Colleen, for the question. Jennifer, do we have somebody else with a question?
Nicholas from KJZZ submitted the question, will additional funds or resources matter given the nationwide shortage of medical staff?
Will additional funds or resources matter given the nationwide shortage of staff? Director Flanagan can speak to this a bit.
Thank you for that question. Absolutely, we applaud the governor for identifying additional funding for the hospital systems, and it's going to help. It's going to help keep the nurses that we have within our healthcare system. It's going to help try to entice other traveling nurses to come to Arizona. But we do know nursing is a national shortage, but the funding certainly helps, and all the other strategies we're doing, setting up these monoclonal antibody infusion centers, getting volunteers to help out, all come together to help make a difference. So that's why it's so important that all of these things continue to be our efforts moving forward.
Y la pregunta es, ¿acaso se necesitan más fondos, recursos, porque tenemos falta de personal? Bueno, aplaudimos la decisión del gobernador de poner más fondos, ¿verdad?, en el sistema hospitalario. También sabemos que la falta de personal médico, no solamente aquí en el condado de Maricopa, sino a nivel nacional, y también para poder dar mejor servicio, como las terapias monoclonal, también se requiere más personal. Y esperamos que con estos fondos que han surgido puedan ser más atractivo y llegar más personal médico también aquí a nuestro condado.
Thank you, Nicholas Gervis, for that question. Jennifer, anybody else?
Nicole Grigg has a follow-up question. Nicole, please unmute your phone.
Thank you. During the last winter surge, we needed more and more capacity. Yavapai County just announcing that they need refrigerated trucks. Does Maricopa County think that they'll have to get to this point again, or are there other resources that are needed this time around with this winter surge compared to last year?
Yeah, I can address at least the temporary morgue system that we had set up previously. At this point, we have emergency management, which communicates with funeral homes and monitors that system. Also, our medical examiner is monitoring the system as well. During the previous surges, the medical examiner, they did expand their internal capacity, but as many reporters know, that the medical examiner doesn't see a whole lot of COVID cases come in to OME. That's just not their mission. Most people die under the care of a physician, and that physician would then sign a death certificate. So that's a little bit different process, but I refer to our medical examiner sometimes as the canary in the coal mine, and that is a place where we can start to see if there is stress on the system if funeral homes are not able to take the bodies from the medical examiner's office. So that's one thing we're monitoring. Public health keeps their eye on that, and I'm perhaps stealing Marcy's thunder a little bit, but that is kind of out of public health. Public health is aware, but the medical examiner and emergency management are the primary agencies that are monitoring that, and so we just got a report yesterday, in fact, that so far there is not a need for that here in our system, but we are watching that on a weekly basis.
Bueno, la pregunta es que si también aquí en el condado de Maricopa se ha dado a conocer, como ya se dio a conocer en el condado de Yavapai, que necesitan camionetas refrigeradas o congeladores portátiles. Bueno, el sistema que tenemos aquí de morgue, nosotros nos estamos comunicando precisamente con las casas funerarias, también con el médico forense, ha incrementado la capacidad, pero no se ven muchos casos de personas que lleguen por COVID-19. Estamos monitoreando la situación, salud pública, el médico forense y las casas funerarias, pero al momento no hay necesidad de traer ese tipo de transportación o congeladores móviles.
Thank you for the question, Nicole, and if you do have a follow-up to that, just let us know. Jennifer, do you have any other folks waiting to ask a question?
We have no additional questions.
Okay. Well, if there are no additional questions, we'll end this press conference. We certainly appreciate all the reporters that joined us today, and those of you in the public watching on YouTube or Facebook. We're happy to give this update. We certainly wish we were in a different spot, as Director Flanagan mentioned, but we'll provide more updates as it seems appropriate. But we hope everyone has a great holiday season. Please be safe. I hope you heeded the words that came from our experts today about the spread and about the situation we're in. We'll see you next time.